Shaving, waxing, hair removal creams. Have you ever wondered what is the safest option? Well, I'm Dr. Rena Malik, board certified urologist, sexual health expert, and advisor to FemHealth, your number one source for evidence based health information for you by doctors. Now, survey studies report that 88 to 96% of women remove their pubic hair. Not so surprising, but what are the options for hair removal? These can include things like shaving, waxing, depilatory creams, laser hair removal, trimming with scissors or clippers. Now, generally speaking, these can all be safe and effective options. However, reports estimate that 75% people who remove pubic hair have experienced genital itching on at least one occasion. Greater than 40% have had genital cuts, 40% have had a genital rash, and nearly 15% have genital pain. Now, most of the time, these are self-limited, meaning they go away, but 3% of them actually had to get medical attention. So let's talk about the options and the pros and cons for each of them. Let's start with the most common option, shaving. Shaving the bikini area is generally easy and affordable, so lots of people choose this option. But there's a few things that you need to make sure you do to prevent infection or ingrown hairs in the area. First, always use a clean and sharp razor to minimize the risk of cuts or irritation. And make sure before you shave to soften the hair with warm water. That allows the hair follicle to swell so that when you shave, you'll be creating a blunt edge of the hair rather than a sharp edge. And hair with sharp edges are more likely to go curve back, pierce the skin, and cause an ingrown hair. And this essentially is a hair that coils up in the skin after it's been cut. Also, use a shaving cream or gel to make sure you create a protective barrier between the razor and your skin. This helps reduce friction and reduce irritation when you're shaving, and helps reduce the chances that you're going to cut yourself or nick yourself while shaving. And these cuts and nicks and additional friction can actually promote hyperpigmentation. Remember to check out my video on why vulvas tend to be darker than other areas to learn more about that. Also, remember to shave in the direction of the hair growth. This reduces the risk of ingrown hairs, as we mentioned earlier, and those can actually be really uncomfortable. Also, if you use a moisturizer after shaving, this can help with irritation, but you want to avoid using moisturizers with fragrances or glycolic acid, because if you have some microscopic abrasions or cuts, those can get irritated with additives like the ones I mentioned. Lastly, if you have poorly controlled diabetes, I would generally avoid shaving in the area at all. This is because if you have poor blood sugar control, it can make it easier to get infection. And one of the infections that we see as urologists is called Fournier's gangrene. This is a life-threatening infection and requires immediate surgery. This is rare, not to freak you out, but certainly if you have really bad diabetes, I would avoid shaving. Now, what about injuries from shaving? Well, because shaving is the most common form of hair removal, we see the most common injuries coming from shaving. So about 83% of injuries related to pubic hair removal that show up in the emergency room are related to shaving. Now, again, this doesn't mean that you shouldn't shave, but use the tips we told you to help ensure that your shave is safe every single time. Number 2, waxing. Now, waxing can provide longer lasting results compared to shaving, but it can also cause some discomfort. If you decide to try waxing, you can consider going to a trained esthetician, or make sure you have someone using proper technique to avoid damage to your skin. If you want to try it at home, there's a couple things to keep in mind. One, to help with pain, consider taking a acetaminophen or Tylenol, as well as an antihistamine 30 to 45 minutes before, as long as you don't have any contraindications to taking those medications. And make sure to follow the instructions in the at-home wax kit carefully, and always do a patch test beforehand. Now, what that means is that you put a little bit of wax on your arm and follow the instructions for hair removal to make sure you don't have an allergic reaction to the product. And injuries from hot wax related issues is not uncommon, so make sure the wax is not too hot prior to using it. And to get a better wax, make sure you exfoliate the area a day or two before to remove any dead skin cells, and that way the wax can stick better and properly, so that when you remove it, you're actually getting the hair removed. Again, use a moisturizer that doesn't have any irritating additives like fragrances or glycolic acid afterwards. Number 3, depilatory creams. Now, how these work is they break down the hair's keratin structure or the proteins of the hair. Now, this thins and dissolves the base of the hairs so they are broken off when the cream is wiped away. These creams are relatively painless and can be done at home. However, they can irritate the skin. So again, really important to perform a patch test to make sure you don't have a reaction to the cream. Always follow the instructions on the cream and never leave the cream on for longer than recommended, as it can then cause skin irritation and discomfort. After you remove the depilatory cream, rinse the area with water and apply again a gentle, sensitive skin moisturizer to soothe the skin. Number 4 is laser hair removal. Now, this method uses laser technology that then targets and destroys the hair follicles. This causes reduced hair growth over time, and it's generally considered very safe and effective. But it's important to use a reputable clinic or a trained professional because certain lasers are better for certain skin types and certain hair colors, and they often require multiple sessions spaced out by weeks or months. And when you get the laser hair removal, you do need to avoid sun exposure, and otherwise you can have risks of skin irritation, burns, and a rare chance of skin pigmentation changes, meaning your skin can get a little bit darker. Lastly, let's talk about trimming. Trimming is a popular option for those who prefer to keep their hair neat and tidy without really completely removing it. It's quick, easy, cheap, and can be done in the privacy of your own home. And trimming is safe when you take your time using gentle, controlled movements and using cleaned, sanitized scissors. You can even buy a dedicated bikini trimmer. Now, trimming is a great option for maintaining a more natural look or for those who prefer not to remove all the hair. However, it doesn't leave the area as smooth as some of the other hair removal options. And there you have it, our rundown of some of the most common hair removal options for the bikini area. Now, remember, everyone's skin is unique, so what works for one person might not work for you. So it's all about finding the method that suits you best and ensures your comfort and safety. If you found this video helpful, make sure to like this video and subscribe to our channel and hit that notification bell so you don't miss our new videos each and every week. Thanks so much for watching. And as always, the doctors of Femme Health are here for you and your family.